Hi everyone, thanks for coming back. This week's topic, we're going to talk about what is autism spectrum disorder. Well, first of all, I'd like to say that if you suspect of someone having autism spectrum disorder, they have to be medically diagnosed. It can't just be someone. It can't just be anyone that says, oh, this individual has autism, and that's that. You have to take them to a physician and have them evaluated psychologically and developmentally so that they could get a better look at the child or individual and say, hey, you know, this kid does have autism or does not have autism, and then you could go from there. Now, autism is different across many individuals. Autism is a particular disorder that is not very consistent with many people. You may see some similarities, for example, with 2 5-year-olds that have autism, but their behaviors might not be the same. Autism can impact any individual actually in various forms. There's a spectrum, that's what they call it, autism spectrum disorder, because there's a variety of behaviors that we see across many individuals. Now, behaviors is observed differently across many people. Sometimes it could be a little bit severe, a lot of the times could be not so severe. Autism is defined by its characteristics. For autism, there are many deficits and many categories in an individual. For example, some of the deficits can be social and emotional. Another deficit could be nonverbal communication behaviors that are used with social interaction. Another sign of autism is developing and maintaining understanding relationships. So sometimes individuals with autism have a difficult time building relationships, speaking to someone, and also understanding emotions. For example, when I see individuals with autism that have a deficit in emotions, when they see someone crying, they cannot relate. It doesn't mean that the person with autism can't cry. It just means that they cannot identify emotions. For example, if let's see, little Sally is crying, and I ask Toby, hey Toby, why is Sally crying? Sometimes kids with autism would not know how to respond. They wouldn't understand why are they crying. Also, with one of the signs with autism, the developing and maintaining relationships as well as communication behaviors, they might not understand how to approach someone and say hi. Again, according to the DSM-5, another symptom of autism spectrum disorder is the nonverbal communication behaviors. This is observed when individuals with autism cannot respond or do not understand having a back and forth conversation with someone else. Sometimes I might feel when I go up to a class just to observe, I like to walk around with kids and see what they're doing. Sometimes I like to interact with them. And one of the main points that the DSM-5 outlines is that there's a deficit in nonverbal communication with individuals with autism. Now, all kids with autism or individuals with autism might not exhibit this type of deficit, but it could be observed. This is one of the symptoms that forms part of autism spectrum disorder. The way this could be observed is, for example, if I go to a child and I say, hi, how are you today? And they don't respond, or it may take a while to respond, or say something completely different, that could be a sign. So according to the DSM-5, we have another deficit that we could be observing in individuals with autism, is a deficit in developing, maintaining, and understanding relationships. So for example, these individuals have a difficult time having a back and forth conversation, understanding relationships such as siblings relationship, parental relationships, friendship relationship, and things like that. Another way we could observe this is the way they make friends. Sometimes individuals have a difficult time making friends. Sometimes they lack, or they don't have the ability to go up to someone and say, hi, my name is Johnny, or to find other people's interests. They are easily distracted sometimes depending on their severity of autism. Another way that we could observe if a child has autism is when we observe repetitive motor behaviors or stereotype motor movements, sometimes these could be defined as stimming, rocking back and forth, waving, and these are maintained by a sensory or aromatic need, a stimulation that they like. For example, sometimes when I observe kids that are clutching their hands or pressing on their feet, is because they like the sensation. Then becomes a definition for a sensation that they like. It's something sensory that they like. Another characteristic about autism is the emphasis on sameness or the inflexible adherence to routine. So sometimes individuals with autism may like a strict schedule. For example, they like a routine. For example, in the morning, wake up, brush teeth, shower, get dressed, and leave to school. If anything in that routine is disrupted, they could exhibit maladaptive behaviors, tantrums. According to DSM-5, some of the symptoms that we can see in autism spectrum disorders are behavioral. So it says here, inappropriate social interaction, poor eye contact, impulse behavior, impulsivity, repetitive movements such as stimming, self-harms. This could be when an individual has a tantrum, for example. What I have seen is individuals will hit themselves. These are defined as self-injurious behaviors. And then also we could see persistent repetition of words or phrases, which is defined as scripting. Another thing that we could see is a deficit in developmental. So there will be a deficit in learning, speech in a child, depending on the severity of autism that they have. Another characteristic or deficit that autism can be displayed according to the DSM-5 is the deficit in cognitive. So what we could observe is a deficit in learning. So sometimes they have a difficult time learning. There's a learning disability that they may acquire because of autism. There's also other symptoms that we could see, for example, anxiety, tone of voice changing, and this could be due with the scripting. For example, we could observe individuals script movie titles or movie scenes from different movies, and then the voice will change. Something like having a first person or second person tone of voice. Another characteristic of this could be the sensitivity of sound. A lot of times what I observe is individuals would have behaviors or have tantrums because of loud noises, or they are more sensitive to sounds. So there are treatment available for individuals with autism. Sometimes when choosing treatments for a kid with autism, make sure it is research based, meaning that you have facts and you have research that backs up why certain treatments work a certain way, or the procedures work or are presented in a certain manner. The important treatments consist of therapy. So this could be, according by the DSM-5, it's early recognition, so as well as behavioral education and family therapies that are potentially able to reduce symptoms as well as maladaptive behavior. So once again, this week we learned what is autism spectrum disorder, and in the upcoming weeks we're going to learn more about what is ABA, what is it used for, how can we use it to increase behavior, decrease maladaptive behavior. If you have a specific question or concern about a topic in ABA, don't forget to comment below, and don't forget to click the subscribe button. Thanks for watching.